All right. Good afternoon, everyone. Thank you for coming to our presentation. And in the next 35 minutes, we're going to give you a very brief primer on practice facilitation and how to incorporate practice facilitation into your research projects. Throughout this presentation, feel free to enter questions you may have in the chat. We'll monitor and try to answer as we go along in our presentation. We'll also leave a few minutes at the end of this session to respond to questions. And if we don't answer all your questions, feel free to reach out to us. This is a team effort today. I'm Jeanette Waxmonsky. I'm an associate professor at CU, Anschutz Medical Campus in Family Medicine and the School of Public Health. I have about 20 years experience in industry and academia, both in clinical operations and healthcare systems, but also in research focused on implementation and evaluation of integrated behavioral health services for a variety of patient populations. And I also have specific expertise in practice facilitation. Stephanie Kirchner, who will be presenting after me, is the Practice Transformation Program Manager at the Practice Innovation Program at the University of Colorado. She's been working in quality improvement and practice transformation since 2006, and she collaborates with multi-stakeholder teams and practices and communities to adopt sustainable, evidence-based, patient-centered methods to achieve the quadruple aim in healthcare. And then finally, Robyn Wearner is a practice facilitator, helping primary care teams work on continuous quality improvement and implementation of research projects in the Department of Family Medicine. She's also a registered dietitian, instructional designer, and project management professional, and has supported numerous projects at the University of Colorado since 2004. So we're a pretty experienced team. And next slide, if we could advance it. Thanks. So we're going to quickly describe what practice facilitation is and how it can be used in research projects, and then go into identifying the planning elements you need for practice facilitation or implementation facilitation for your research project. I'm going to cover what practice facilitation is and what practice facilitators basically do and provide you with some case studies. And then Stephanie's going to go into detail about planning for practice facilitation and some of the activities and resources that will be useful for you. Next slide. So what is practice facilitation? Well, first of all, as many of you know, getting evidence-based practices into real-world settings is no small task. It involves a lot of work. It involves understanding the context of the practices you're working with. And practice facilitation has come about and developed into an evidence-based strategy that allows you as a researcher to help build the organizational capacity and quality improvement with practices so you can enhance the uptake and sustainability of whatever intervention you are introducing into a practice. This is really important when you're dealing with complex kinds of interventions that disrupt workflows, cause a lot of changes within practices, and it really takes an intentional, well thought out effort to help implement your particular intervention. And why do we do practice in facilitation? We do know there is a research base for this. We do know it helps maintain sustainability of interventions. We also know it helps with cost effectiveness, that you can get a return on investment in particular studies for using practice facilitation. So what does a practice facilitator do and who are they? These are specialized individuals. They are trained in a curriculum around practice facilitation, and they develop 4 competencies. The first one is interpersonal skills. And part of this is, I would say, is personality. You need somebody who's flexible and someone who is very personable to work with practices. So somebody who can go in there and roll up their sleeves and make friends when they work with a practice. So they need to proactively outreach staff, leadership, help organize, problem solve, become a trusted resource for the practice, and the go-between between the practice and the researchers. They need to have excellent communication skills. The next competency they need to have is they need to be trained in methods for accessing and using data to drive change. So they need to understand data collection, data analysis, and how practices can use that data for their own QI processes. They need to understand change management strategies, as well as continuous quality improvement and how that works within particular practice settings. And they need to know how to optimize health information technology. And sometimes they even need specific subject matter expertise depending on a project's needs. So as a researcher, you may need to train your practice facilitators before they go into the practice on your intervention and some of the nuances of your intervention, so you set them up for success. So practice facilitators, they do a lot, but they sometimes don't work alone. They sometimes work in teams where you can bring in a health IT expert or a data manager or subject matter expertise to work with them to help set up a practice. So what are the key steps for providing practice facilitation in your research study? Well, when you figure out what your intervention is and the types of practices you're going to outreach for your study to be part of your study, you need to think about who, what, when, where, why, and how. So what are the practices needs? What is the FTE you're going to need for practice facilitation? What are the resources that the clinic has already? Do they have prior experience working with practice facilitation or the intervention that you're going to employ? Have they worked on similar studies? You need to determine the timeline, frequency, methods for practice facilitation, and Stephanie will get into that in a little bit more detail. You definitely need to meet and assess the practices via assessments and in-person meetings, develop contacts, processes, and communication. And once you get your practice facilitator involved, they need to explain their role, what they'll be providing and doing, what they won't be doing. So you set clear expectations, and you need to help the practice work on a plan to collect data and reporting, and help with communication between providers or the practice and the researchers, and then provide ongoing support. So what are some of the things a practice facilitator does? They have a lot of strategies up their sleeves. So some of it is around establishing quality improvement teams within practices, creating quality improvement plans, helping with benchmarking, training practices on QI approaches like plan, do, study, act cycles to test, spread, and sustain changes in the practice, provide training on specific quality improvements or engage experts and such as academic detailers to provide training, help the practices modify workflows, policies, procedures to sustain your intervention, help the practice identify exemplar processes that are what's going well and how can they take those processes and share those with other people and other practices, identify resources that they need to implement quality improvement, and help practices really problem solve around some of the challenges of implementing an intervention within their practice. So how do you get started? Well, when you think about practice facilitation, think about who your practice facilitator is. What's their background? How many practice facilitators are you going to use? Are you going to try to have a practice facilitator do a few sessions across a lot of practices? That may make sense in some circumstances, it may not in others. How are you going to, how flexible are your practice facilitation methods? Can you provide extra support for specific practices that need it? What are your metrics for practice facilitation? What's your data collection methodology, and what's your reporting structure to the research team and to the practices. So those are some things you need to think about as you're starting to incorporate practice facilitation into research. Next slide, I'm going to give you some case examples. So these are two examples of how practice facilitation changed over time. And the first one is from the Colorado State Innovations Model, and this is a practice site experience. And I bring this up because it's really a case of making sure you have the right fit for your practice facilitator. So in this very large statewide study, there were 4 mental health centers and up to, I think, 400 primary care practices that were involved in implementing an integrated behavioral health, integrating behavioral health into their practice. And one community mental health center that I was working with was contracted with the SIM office to deliver an integrated care model for children and families within a primary care and mental health center that was fully integrated on the same floor. One of the challenges that we faced, and we meaning the mental health center, because I was sitting in an administrative role at the time, was that the initial practice facilitator was very good at understanding what needed to be done for the SIM project, knew what the metrics were, knew what was going on in terms of milestones that needed to be met, et cetera, but they had no experience working in behavioral health organizations. They didn't understand the language, they didn't understand the workflows, the processes, how behavioral health measures were different than primary care measures, what the metrics were, what the reporting was to the state. And needless to say, the implementation did not go well at the beginning because it was like they were speaking 2 different languages. And so what happened is the practice facilitator was switched out to somebody who had extensive behavioral health experience. And we're really thankful to the practice innovations team for helping us with that, because it really made a difference. This person spoke the same language as the clinic, understood their needs, got instant buy-in, and things went a lot smoother and facilitated milestone implementation. So lesson number 1, get the right person. In my second example, is the Invested in Diabetes study, where I'm a principal investigator on the study. And when we started out, we thought, oh, we're going to implement this shared medical appointment for diabetes in 24 practices in Colorado and Kansas. We're going to just do a 5-session model of practice facilitation to get them up to speed, where they're going to, we're going to figure out what the process mapping is, what the team looks like, how they're going to recruit, market, et cetera, for the study, with just a half-time practice facilitator for the first year of the project. Well, we sorely underestimated the need for practice facilitation. Our practices needed a lot more implementation support, especially those who have never done shared medical appointments. And also in primary care practices, there's a lot of staff turnover. There was problems with recruitment. There was a lot of need for problem solving. And we realized that we really had to beef up our practice facilitation, brought another practice facilitator on, and then we were doing check-ins, or the practice facilitators were doing check-ins with the practices, as well as quarterly stakeholder meetings with the practices to help us figure out what was needed. And it was really good that we set this up this way, because halfway through implementation, this little thing called the pandemic hit, and we had to move all of our practices to virtual shared medical appointments, or the ones that could move to virtual shared medical appointments. And that's where our practice facilitators really worked hard to help those practices problem solve and figure out what they needed to do for keeping the intervention running. So we extended practice facilitation for 3 years of the project, and it's ongoing, and I think it was the best thing we've ever done for the project. So those are just 2 examples of why practice facilitation matters And now I'm going to turn it over to Stephanie, who's going to walk you through kind of the nuts and bolts.
Thanks, Jeanette. You did a nice job of squeezing that into a tight time frame. So I appreciate that. So I'm going to talk a little bit about how you plan for this. And, as we were getting organized to present today, we were talking about, Jeanette could have presented on what is practice facilitation, how does it work, what are challenges, barriers. I mean, that could be a full hour, and so could kind of thinking through implementation. So this is just a little taster, I think, of how we think through how we deploy practice facilitation into research projects. So Robyn, if you want to go to the next slide, we think about this kind of we were talking about buckets. I'm going to go into each one of these individually, but I guess what I would say up front is that not one of these is necessarily more important than the other. I'm not presenting them in a certain order because of that. They all really need to be considered as you're writing a proposal. And if you're going to use practice facilitation, how you think about dose and timeline and measurement and monitoring are all things that the wheel should be turning on that as you're talking to a funder about what you're planning to do to support practice facilitators in the field. So Robyn, if you want to keep going. So really the first thing we think about is timeline. So this isn't just timeline of the entire project, which I think is something that we typically think about in the proposal phase, like how long do we have to get this work done? But really even timelines within timelines of what the practice facilitation intervention will look like. Jeanette described two different projects where we have put practice facilitators in the field. One, the SIM project, the facilitators were with practices for a year, so for 12 full months. And in others, sometimes it's much shorter than that. There's kind of a more prescribed intervention that really only takes a few months of really focused practice facilitation support to get a practice to a place where they can sustain changes on their own. So it really depends a lot on how prescriptive kind of your research is, what are the aims, and kind of, is there something really narrow that you're trying to do with the practice? Or is it something really big that's kind of more, that really requires more practice redesign in order to put a practice in a place where they can sustain a change? So I think a lot of times too, what we think about with timeline, and we're going to talk about this a little bit too with dose, is really talking to researchers too about data collection and there's this drop dead at the end of a project by which data needs to be reported. And so thinking backwards from that about when can you collect it from a practice, because facilitators end up being really, really essential in nudging practices to get data to project teams. So it's kind of, there's this art of really thinking about how do we design this? So not only does the practice get kind of what they need, but how does it support the project in time? You don't want the practice facilitators to be ending their intervention work the month before you have to write a final report that's due, if that's what you propose to your funder. So thinking about all of these things, I don't know, it can be a little overwhelming, but if you break it down into smaller steps, really thinking about how to time this out is important. I think it's also, obviously really dependent on funding opportunities and also whether you're planning on doing virtual versus in-person practice facilitation. So these are all kinds of things that we think about when designing a timeline for practice facilitation. So dose, in the clinical world means something pretty different than when we think about practice facilitation. So what I mean by dose here is how much practice facilitation will the practice receive? What does that support and technical assistance look like to support your research aims? This is a place where, defining expectations of the practice facilitator is really, really essential. Thinking about how often you want a practice facilitator to visit each practice site that you're working in to through your project. How long will those practice site visits be? Will there be other things between practice visits that need to be thought through and budgeted for? And also kind of in this dose piece, I think it's really important for researchers who are thinking about using practice facilitators. I know Jeanette she mentioned this, that we often become sort of ad hoc project managers. It's a really nice liaison person between the place where your research ideas are being played out and the research team, because the facilitators really do create pretty strong relationships with individuals and practices. So they become this touch point for you, but it takes time, and budgeting for that's important. So thinking about emails, phone calls, quick check-ins, things that you need just to get the work done in the practice that you'll probably end up leaning on your practice facilitator for, even though it's not necessarily the core training of a facilitator. That's just sort of what we do. We run a lot of interference for researchers who are working in practices. The next thing we kind of think about are practice milestones. So if you think about, like, generally speaking, I would say the practice innovation program at CU thinks about dosing practices with practice facilitation to successfully support a practice about once a month. So there's a one-time site visit each month that's really focused on, building up a quality improvement team, to think about the changes that you're trying to implement, to drive towards improvements and the outcomes that you're looking at specifically. So you kind of think about that in terms of dose. And then it's really important, I think, Robyn, I'm looking at you, looking deep into your eyes. We spend a lot of time at the Department of Family Medicine, where we both are all the time, talking to researchers about translating these academic ideas, these big things that they want to accomplish, into really small goals that someone in a practice who's not thinking about your research really much at all, I mean, no offense, but they're thinking about all the other things they need to do, how they can get these things into practice kind of in ways that are reasonable and really manageable and really, really measurable. We're going to talk about measurement in a second, but thinking about how to bring your project aims down into milestones that are really actionable for a practice. So, like, what are the 5 steps that a practice would do to achieve the aim of your research project? And then breaking it down again into really small action items that kind of even further define those practice milestones. So that's what a practice facilitator does. They sort of take this big thing and make it smaller and smaller and smaller, so that the practice can kind of follow a roadmap to getting to those really big changes that you're trying to drive towards in your project. So this becomes kind of a dance, I think, between research. I mean, implementation obviously is research and it is science, but there's kind of this dance between how are the humans in the practice going to really be able to do this to help you be successful and help you drive towards the outcomes that you're looking for. And I will also say that translation piece is also really important when you're pitching, when you're recruiting to practices. They often don't want to hear about these big, project aims. They want to hear about, like, what are the little things that you're going to ask me to do, and how is that helpful to me and to the patients that I take care of? So that's kind of what these milestones help us do. And we have examples that we're happy to share, push you to some of our websites to look at things that how we've designed this in the past. So I talked about measurement. I think really the measurement piece, I think we often think about in research about it when we're thinking about what do we need to measure, what are we evaluating, what are we reporting to a funder, but also really thinking about how that translates to primary care practices or specialty practices, whoever you're working with. Like, what are they need to be looking at this information and data that's connected to the things you're asking them to do on a pretty regular basis, like even monthly, to be able to really say, like when Jeanette says we're going to do a plan to study a PDSA on, implementing, I know Jody's here, like implementing opportunities for patients and teams to focus on weight management. Like, they really need to be thinking about what are the measures that my patients care about, that I care about in my population of patients, that would be helped by using this tool that we're trying to implement. And then they need to look at that regularly so they can see whether what they're trying is working. And I don't know who said it to me first, somebody very wise, long time ago, but like, if you're not measuring it, it's not going to change. It's not going to move. It's not good. And we don't know if what's working and what's not working. So trying to think about ways to break things down into reports and things that are easy for practices to pull not asking them to look at things that are really off the charts, hard to get out of an electronic health record, trying to avoid asking them to do manual data tracking. Like, think about how you can be really pragmatic in what you're proposing in terms of measures. This is a huge part of what practice facilitators do. And there's like this huge new, even specialty of practice transformation around clinical health informatics that's really, really essential to be comfortable with data, to be able to pull it, to be able to analyze it to some extent and help practices use it to really drive change. The monitoring piece, I feel, is like my least favorite part of the work that I do right now, but it's really, really important, especially in large implementation studies like we did in the state innovation model that Jeanette mentioned. We had 20 organizations who were contracted to put practice facilitators in the field in Colorado to support behavioral health integration in primary care. And so we needed a way to measure and monitor whether those facilitators were doing what we asked them to do, when we were asking them to do it, and whether it was working. And so it feels a little bit big brother-ish to be kind of focused on this, but it's so important. And it's also a way of collecting information across time that you can use for evaluation. So typically what we do in terms of trying to track and monitor what's happening across multiple practices at one time is we ask for monthly field notes, which again, we try to pitch as a tool to support practice facilitation so that they can use it to look back. What did I do with this practice last time? What are we doing next time? But also it's a great resource for qualitative evaluation of programs at the end. And we also just kind of measure and track. It helps us think, did they go? Did they show up like they said they would? Because we're paying them to do this. So anyway, monitoring is something important and something that to really think about how you're going to do that when you're budgeting and make sure you include time to do it. I know we're running short on time. I'm trying to go fast. So training the practice facilitators, Jeanette mentioned this. I think it's important that they understand just, grant and research aims. What is this project about? What are we trying to get to? Sometimes there's subject matter work that needs to be done around, like if you're implementing something around opioid use disorder, practice facilitators need to understand what it is that you're driving towards clinically, that they'll never be giving, obviously, that clinical resources to patients directly. Having some understanding of that gives them confidence to communicate well with clinicians and really support projects that they're trying to put into play. We also do a lot of ongoing support, knowing that things change over time. I mean, this past year is a perfect example of that, trying to kind of shift to virtual practice facilitation. What do practices actually need? How can our research aims shift over time within some confines to really support practices as things change in the field? So we do monthly learning community opportunities with most of our projects so that we can touch base with people and hear about what's going on, and they can also support and train one another. But this is something else. And I think my next slide is budget, to think about when you're really proposing practice facilitation as a component of your implementation work, because I think, and Jeanette mentioned this with one of the case studies, you're just kind of underestimating what it would take, because we think about just these very discrete touch-based points of site visits, but there's so much else that has to happen to support successful practice facilitation in the field that just takes cash. You got to be able to pay for those resources up front and know that those are going to be expenses to the project as it evolves. And there's also thinking about travel. There's planning time for meetings. It takes a lot of energy and time to support agenda planning and just making sure that we're mindful that it's not just an hour a month that we're trying to think about. I think maybe that's the end of my my spiel. I know that's a lot. I want to say too that we're here to help you think through this in a more concrete way. At the Practice Innovation Program, we can help you think through how this applies to a specific grant or a research project, and would be thrilled to do that. So I think I'm going to pass to Robyn to kind of talk about some of the resources to support the things that we've been describing today.
Thanks, Stephanie and Jeanette. I just attached what we're calling an activity sheet in the chat here for you to open, download, and use. Keep in your files whenever you're writing a proposal and thinking about incorporating practice facilitation. These are the buckets that Stephanie just went through, and some questions to help you think about, have I thought through this as thoroughly as possible, so it's not a hindsight is 2020 situation right as you're getting started with your implementing your project. So that activity sheet is helpful in terms of thinking about writing proposals and thinking about your projects in general. Also, as some of the information that Jeanette covered earlier, the VA and ARC have been really helpful in terms of developing their own practice facilitation manuals. And these manuals are more about finding the right person, the right fit for your project, and what skills. It's that balance of the skill and art of practice facilitation that they both of these agencies spent an awful long time, and a great number of experts were helpful in compiling these wonderful manuals and documents that are available. I will also put these links in the chat. I know you're not able to click on those, so I'll put those links in the chat so that you can file those for later. Do you have any questions for us at this time? We'll go back also to the chat, which I see Jeanette and Stephanie have been chiming in about. Jody asked a question that I think it would be great for Stephanie to answer, and that was about utilizing existing practice facilitators when they exist. What are the benefits and drawbacks of that option if it's there?
I'd say there's way more benefits than drawbacks. I mean, really, I think because one of us said something about relationships are so essential. And when you have a practice facilitator who's been working with a practice for years, even if it's on a completely unrelated project, and you can leverage that relationship to get your work implemented quicker, like they know who to call, they know how to talk, they know what not to say, they know when not to call, like all those things are so important, because it really is oftentimes those really little things that help things fly or make things flop. So I would say that's a huge piece. Jody, I'm not sure if you're also saying, I mean, we have practice facilitators within the department, and then we also have them that we contract with, because Colorado is geographically pretty challenging. So I would say it's better to contract with somebody who lives on the other side of the continental divide, who has relationships with practices, than to try to do it in-house, because it'll take, well, travel time for sure, but just even relationship building, it's much more challenging.
And I'll just build on that with one comment to say that when COVID introduced this whole concept of complete virtual practice facilitation for us in 2020, those of us that had existing relationships with practices made that transition a bit easier than if you did not know that the practice team prior to that. And that doesn't mean to say that you can't start virtually and have success. You can. We've done that actually, and that's okay. And it just takes a little bit longer for the practice facilitator and the team to get to know each other and how you work together, virtually. Let's see. I don't see any other questions that I don't think have been touched on. And I think we're just about out of time. Stephanie, Jeanette, you have anything else?
I was just going to comment about the whole weaning off process. It's like, obviously, use the data and milestones, and we have field notes from our practice facilitators that we go over, and we group people into like green, yellow, and red groups, like a stoplight, like which practices are doing just fine and we don't have to touch them anymore. They're good to go. Then there's some who are having some minor issues where we need to kind of help them. along. And then there's some that are really struggling where we have to really rethink our practice facilitation intervention. And sometimes those barriers are at a systems level where we can't really do too much. So, you know, we have to just be flexible and kind of gauge where practices are at in terms of what they need. And obviously, if you have a lighter intervention, if you will, something that's not a big lift for the practice, you could get to those milestones rather quickly. It'd be nice to see some research looking at practice facilitation dosage based on types of interventions implemented. We definitely need more research in that area. Any other last minute questions? Well, thank you all for your time and attention.
Yeah, thanks so much. It's I feel like we kind of went fast, but it's great to see all of you.
We decided we have a workshop material here, so maybe we'll see you next year.
Thank you very much, everyone. Thanks for attending COPRHCon 2021, day one, and we hope to see you tomorrow. And tomorrow we'll be focusing on data sources for pragmatic trials. So thank you, everyone, and we will see you tomorrow.
Thank you.